Good evening, everybody, and welcome to this evening's webinar. My name is Gillian Holmes, and I come to you from here in the UK. And this evening, we're going to be discussing the topic of skin sensitivity. So we'll be looking at essentially what causes skin sensitivity, who indeed would suffer from skin sensitivity, and of course, we want to look at some of the Genesis products that can help alleviate some of those symptoms. This session will be recorded, so please, if you can, do keep your cameras off and mute where you can. We do welcome questions throughout the webinar, so please, if you have any questions, feel free to type them in the chat box. We will cover as much as we can at the end of the session. So today, as I said, we'll take you through skin sensitivity. We're going to look at its causes, the impact that it has essentially, and some of the advanced solutions that we can use to try and alleviate it. So a quick introduction in terms of what we will actually cover today. We will look at the prevalence of sensitive skin, so how many people actually do suffer with sensitive skin. We'll look at the important anatomy and physiological facts about sensitive skin, the importance of understanding the causes, and I would say professionally, this is one of the most important things and the most important steps that you can undertake in terms of dealing with somebody that has come to you with a sensitive skin. Towards the end, we will look also at effective solutions to help alleviate those with sensitive skin issues. First, we want to look at the demographics and the impact that that may have. So who essentially suffers from sensitive skin? So sensitive skin is a common dermatological skin concern. It affects various different demographics quite differently. And we're going to have a look at some of those statistics now in terms of who is likely to suffer, what those causes might actually be. So sensitive skin. Sometimes we almost say that sensitive skin could be classed as a marketing term. It doesn't seem to have a clear definition, especially for consumers who may end up as your patients and clients. So it doesn't leave it simple enough for them to understand. 60% might actually self-report having sensitive skin, but without any underlying inflammatory skin condition. Without that, it is not likely to be truly sensitive skin. So what could be happening there is that a client or patient may be doing things to their skin, using the incorrect products, being exposed to environmental factors, for example, that could be having a sensitizing effect on the skin. And the two things are very, very different. So true sensitive skin must be clinically diagnosed. And we'll talk about that in just a second. So who suffers from sensitive skin? It will differ depending on the age group that you're dealing with. Professionally, unless you work in dermatology, you are less likely, of course, to see very young children. But young children in particular can suffer with quite naturally more thinner and delicate skin. So for younger children, conditions like eczema are quite common. For those adolescents, obviously there we're dealing with the issues surrounding puberty. So in puberty, hormonal changes can change the skin. For young males in particular, obviously those sebaceous glands are more active, so they are dealing with acne sometimes as an issue. When we look to younger adults, adulthood in particular, we could say 50 to 70% of adults report having more sensitive skin. And that may be because they are coming across issues and factors external to themselves that are creating that sensitive skin environment. We then look at the elderly, who of course, again, we have that thinning of the skin and a decrease in lipid production, which naturally leads to drier and more easily irritated skin as well. So throughout different age groups, we are faced with a number of different factors that at some point within our lives, if we don't suffer with sensitive skin from birth, we are likely to have suffered from something that has created a sensitized skin. So another factor we look at is geographical issues. So when we look at geographical factors, we look to things like the climate. So geographically where you live, what is the climate that you are facing? So very, very harsh environmental factors can have a severe impact on the skin. And looking in particular at countries specifically, for example, even in the UK, in the more urban areas, in the cities, for example, you're faced with more pollution, potentially more stress as a result of work in that environment. And again, these are all factors that can enhance the likelihood that you will suffer with sensitive or sensitized skin. We look to gender because there are always differences in how the two genders kind of experience different skin conditions. So females typically are more likely to report sensitive skin. We're looking at about 60 to 70% of females more likely to report sensitive or sensitized skin. But again, that comes with some of the issues we face, in particular, let's say, for example, menopause symptoms. That can change the skin, that can bring a lot of issues in terms of the changing condition of our skin. So we look also at the other contributing factors. So ethnicity is an example. Sensitive skin or sensitized skin typically is more common in European cultures. That being said, we're looking at lighter Fitzpatricks, so skin with essentially less melanin. Obviously, a skin that is lighter is more likely to show the signs of sensitivity. So one of the main signs being redness and inflammation will be more likely to show on a lighter skin type. Lifestyle has a factor on many different skin conditions, as we've covered certainly in previous webinars. So your lifestyle has a huge impact on the health of your skin. So are you stressed? Do you suffer with high stress levels as a result of the work that you do, your living situations, smoking, excess alcohol, poor diet? These are all things that can contribute certainly to either a sensitized skin or aggravating an already sensitive skin. And we look to healthcare access as well. This is going to differ greatly depending on location, geographically. But of course, not everybody has the same access to things that can help us in terms of improving the skin. So in order to understand sensitive skin slightly better, we want to know a little bit more about the physiology. And I'll take you through some of the more commonly known skin conditions as well. So what is sensitive skin? So really there is no clear-cut definition. If you have sensitive skin, you'll know. If your skin is sensitized, you will know. So it is something that when we have it, it is extremely obvious to us. And it's one of the first things that will be reported in a consultation with your aesthetic therapist, your nurses, your dermatologist. It will be the first thing that is mentioned if you do suffer. So typically sensitive skin is more reactive. It is more prone to breaking out, reacting and responding to products, and also mild changes in the environment. So we talk about, certainly here in the UK, the way that the seasons change from summer to autumn, and then obviously autumn to winter. There is a big difference in climate, and that can have an effect on the skin itself. In summer, we are more prone to obviously UV radiation. So again, that can have an impact and a trigger for those that suffer with sensitive skin. Itching, dry, stinging sensations are just some of the signs and symptoms that people report when they come to you with sensitive skin. Excuse me. So we look now at the physiology of skin sensitivity. And so we know that the skin barrier is a hugely important factor in skin health in general. So we call the skin barrier the guardian of our skin health. Skin sensitivity and barrier function are all linked to things like transepidermal water loss also, and loss of water leads to dehydrated and dry skin. Again, something that anybody that comes to you will report. So when the skin barrier is impaired, moisture loss does escalate quite quickly. So that has to be quite quickly again restored and repaired in terms of the correct products and treatments where necessary. Neurogenic inflammation and sensory nerves. So with your neurogenic inflammation is essentially heightened neurosensitivity. So the sensory nerves in the skin react intensely to quite normal stimuli, which to a non-sensitive skin wouldn't ever have an effect. So nerve signals then trigger an inflammatory response that leads to things like redness, itching, and discomfort, which are all characteristics of sensitive skin flare-ups. So we look at the skin barrier itself. Now, the picture is there to kind of illustrate that bricks and mortar effect of the epidermis, essentially the very, very top layer, the stratum corneum of the epidermis. So the epidermis itself looks or should resemble a brick wall. So we have the skin cells or the keratinocytes. These are the bricks, and we then have the mortar, or what holds everything together, which are proteins, your lipids, and fats. And these hold your keratinocyte skin cells together. Now, lipids protect the cells, and they help to prevent transepidermal water loss, which is hugely important for maintaining skin health. Essentially, when you compromise the barrier lipid layer, it is almost as if you are creating microscopic tears or fissures or cracks in the skin. So when we apply then our normal products, we can create sensitivity and stinging sensation, and until that barrier is repaired fully, the inflammation will just cascade and get worse and worse. So the skin barrier itself also prevents microbes from penetrating the skin, again, hugely important. And we have a mix of the ceramides, the cholesterol, and the fatty acids with a ratio of 1:1. For those three are ideal. So when this is impaired, when this is out of balance, that's when we start to get that inflammation. That's when normal products begin to irritate the skin, and we suffer with sensitivity. I've mentioned already some of the causes, some of the triggers that can impact the skin health. So we look to environment, it's critical. Where there's a higher incidence of air pollution, this will cause an increase in sensitivity. Exposure to UV damages physiologically the skin and can lead to an increase in sensitivity. Lifestyle factors, even sometimes, is very common in clients with rosacea, that they report certain things, spicy foods, alcoholic drinks can make their symptoms a lot worse. Stress is a common concern for a lot of people today, and stress can have an influence on the skin in many different ways as well. So when stress is a trigger, the symptoms, the inflammation, the redness can get worse. As stress is managed better, the symptoms can start to alleviate, but it's a very difficult cycle to try and break. Those prone to eczema or psoriasis are more likely to suffer from sensitive or sensitized skin throughout their life, but of course that is a inherent sensitive skin that has been sensitive since birth. So a common denominator are influences that are negatively impacting the skin's natural barrier lipid layer, the skin's normal defense mechanism, and compromised barrier lipids result in a number of potential problems with the skin. So we will look at how to fix those in a while. Now, I will admit that when I was writing this presentation, I did become slightly itchy when I did this slide. So I hope you're not about to eat any food, but it is important that we cover the Demodex mite. Now, Demodex are essential and we all have them. We need them, in fact. So the role that they play, essentially, is for things like cleaning pores. They help to clean the skin's pores, consuming dead skin cells, and maintaining the oil sebum on the skin surface as well. They help to maintain microbiome balance on the surface of the skin. So they play a role in maintaining the balance of any microorganisms on the skin. And they achieve symbiosis. So that essentially means, what I said at the beginning of the slide, is that they engage in a symbiotic relationship with humans. So their essential presence is needed. And generally, for most people, Demodex presence does not irritate the skin. However, in cases where the immune system becomes weakened, hormones change, so that could be due to puberty, it could be due to menopause, where we see an increase in oil, because obviously the Demodex is there to control oil on the skin. So when oil production is greater, then that's where the proliferation of Demodex begins, and that's where it becomes an issue and causes sensitive skin. So looking at the Demodex themselves, they are microscopic organisms. They live on all human skin, but the proliferation of the Demodex can contribute to things like rosacea and sensitive skin by triggering inflammation. So the most common types of Demodex, Demodex follicularum and Demodex brevis. Overgrowth of the mites can disrupt the skin barrier, provoking an immune response and leading to the symptoms that you tend to see: redness, irritation, and sometimes pimples as well. When it is discovered that Demodex is the issue that is causing the sensitive skin, then you look to things like topical or oral medications to try and reduce that mite population. Ivermectin or metronidazole are common treatments in the UK. A gentle skincare routine to minimize irritation and avoidance of triggers, which will of course make those symptoms worse. I'll move on from this slide just in case you're eating. So clinical signs of sensitivity. Now there is quite a long list in front of you, as you can see, but it is not limited to the list that I've included. So people will come to you with lots of different signs and symptoms of sensitive skin. And every case will differ ever so slightly. So you look for things such as obvious redness. Now this can be diffused, it can be all over the skin, or it can be in small patches as well. Swelling in certain areas, obvious signs of inflammation. As it can also make the skin quite dry, you might see some signs of flaking of the skin, open cracks in the skin, as well as dryness. And for those that have become quickly sensitized, they may even report kind of an itching, burning, or stinging sensation. You may also get in cases of things like rosacea, as an example, pustules may be apparent on the skin surface as well. So I've touched on it a number of times now. You either have sensitive skin or sensitized skin. So it is all dependent on whether you were born with it. True sensitive skin, somebody will have had from birth. So I mentioned some of the characteristics and who's likely to suffer with sensitive skin. And as I mentioned, it does tend to be those with the lighter Fitzpatrick, so skin type 1, 2, possibly even skin type 3 on the Fitzpatrick scale. Normally quite porcelain or translucent skin. Very often redheads who would suffer as well. And it is typically genetically predisposed. So again, looking to the parents, if either parent has suffered with sensitive skin throughout their life, it could be that that gets passed on. So those issues that I've just mentioned, they are intrinsic causes of skin sensitivity. So essentially, there's not really a lot that you can do about it. Intrinsic causes are something internal to you, genetically what you are predisposed to be like. In those cases where somebody comes to you with truly sensitive skin, this is when it is almost like you are managing the condition. With a sensitized skin, it's likely that you can create a treatment plan that will alleviate those symptoms. But with a sensitive skin, it will be much more difficult. And realistic expectations for the clients and patients that come to you should be that we are going to help you manage the condition. So those that are sensitized could be that they've created a sensitized skin condition, and it could be as a result of many factors in our lifestyle and environment. So these will be extrinsic factors. So looking then at the difference between the two, sensitive skin is a skin type, whereas sensitized skin is a temporary condition, often resulting from external factors. Sensitive skin is characterized by a heightened reaction to external or internal triggers. So it'll always be there, but it sometimes will get worse, sometimes it will settle as well. As I mentioned, it's often genetic. It tends to manifest as redness, itching, burning, stinging sensation, and they may experience discomfort or irritation in response to various factors. Typically, sensitive skin will be thinner, and it will also have a weakened skin barrier. So for those that are sensitized, it is not necessarily permanent, but rather a reaction to very specific triggers. Now, it's very important in that case to identify what those triggers are so that they can be stopped. Those that are sensitized may exhibit symptoms very similar to sensitive skin. And once the triggers are identified and addressed, sensitized skin can often return to a healthier state, which is what I've mentioned previously. So essentially, sensitive skin is inherent with a tendency to various triggers, whereas sensitized is a temporary condition resulting from external factors. Both, as I mentioned at the end there, do require kind of gentle interaction in terms of treatment options. Now, sensitive skin conditions in particular, as many different skin conditions can, do have a significant psychological impact on individuals that suffer. So these conditions often lead to chronic discomfort, physically feeling the pain of that sensitive skin, which can result in high levels of stress. And of course, stress is often a trigger to those with sensitive skin. So it is a bit of a vicious cycle in terms of how to treat it. And that can also lead to feelings of anxiety and depression as well. So those with sensitive skin may experience that low self-esteem, body image issues due to those visible signs and symptoms that you see, such as the redness, rashes that you can get, and often pimples and pustules as well. Some of the challenges that are faced by individuals managing their sensitive skin, I always feel it's important to kind of put yourself in their shoes. If it's not something that you have suffered with before, then try and think about how they might feel in that situation. I often find there's a great deal of confidence needed just to step foot into clinic and come and talk to you about how you can help. So that puts you in a very kind of responsible but amazing position to be able to help them and improve overall that self-esteem. So some of the challenges that they face: constant vigilance. So it's almost like they have to be cautious about the products that they use. What are they using? How often they're using it? Is it irritating their skin? Is it making it better? It's almost like they're always on edge, trying to figure out what's good and what's bad, what they can do and what they can't do. So this is very restrictive in terms of their lifestyle. So things like swimming in chlorinated pools or spending an extended time in the sun sometimes has to be completely off limits, even to the point where, hot showers can have a really bad impact on somebody that suffers with sensitive skin. And going to the gym as well, perhaps that self-esteem issue, they might not want to go to the gym in the first place, but again, if we sweat, if we're hot, blood vessels are dilated, symptoms can often look worse. So it does have a significant impact on their lifestyle. This can lead to social isolation, so a feeling of self-consciousness, social withdrawal, impacting personal and professional relationships, huge impact on their life. And medical costs. Medical costs are cost of products that they're actually having to try and always almost experiment with and look for that quick fix as often as possible. Often means that they come to you having spent a lot of money on other things. So it's a little bit of trial and error, finding suitable products. Can be a bit of a frustrating process, but when they come to you, you can suggest to them the Genesis products that we will go through, and of course start to try and alleviate those skin issues and help them achieve a healthier skin. So some types of sensitive skin that we see, excuse me. Contact dermatitis is quite common. It can be caused by an allergic reaction to specific substances, perhaps irritants as well can have an effect immediately on certain skin types. Psoriasis, an autoimmune skin disorder, which is characterized by raised red scaly patches. Sensitive, acne-prone skin, again, has a huge impact on self-esteem. So it's skin that's prone to breakouts, but also sensitive sometimes to harsh acne treatments or ingredients. So balancing sensitive skin with that acne as well can be quite a challenge. Allergic reaction, so obviously this is quite a temporary situation, temporary skin condition. If you have an allergic skin reaction to something, it's kind of immediate hypersensitivity. It could be from foods, medications, insect bites as an example, or environmental triggers such as pollen. And these can be quickly alleviated. Skin barrier dysfunction is a condition or factors that compromise that skin barrier, which we know is hugely important in protecting skin. And neurogenic dermatitis, as well as post-inflammatory hyperpigmentation, which we've covered in previous sessions. So it is darkened patches of skin where there has been some kind of inflammation. But I would also like to add there post-inflammatory erythema, which again is more common in the lighter Fitzpatrick's, where there has been inflammation such as acne lesions. It may leave behind patches of redness as well, which is another inflammatory reaction in the skin. Rosacea is quite a common inflammatory skin condition. It is a chronic skin condition. Now, as I mentioned earlier, management is key here. So there is no cure essentially for rosacea. It is managing the symptoms. It is knowing what the triggers are to enable that person to live as freely as possible without the symptoms that they get. Now, there are treatments that you can engage in for rosacea. I mean, the picture I've included there is quite a classic example of rosacea in that the blood vessels are dilated. They cover cheek area and nose as well. And acne is graded in terms of its severity. So you have grades 1 to 4, but 4 is related to rhinophyma, which affects only the nose. 1 to 3 are grades of severity for rosacea that you will see in facial skin. So blood vessels being dilated are very, very common. And if there's no other contraindications for that person, you can use things like laser as a quick means to try and get rid of the visible blood vessels on the surface. Anything collagen stimulating, such as coarse microneedling, will help to strengthen the skin, produce more collagen, and improve the structural integrity of the skin overall. So common symptoms that you see for patients with rosacea: facial flushing, sometimes stinging, burning, and often in higher grades, pustules as well. So depending on the severity, of the condition, it will depend very much on how you treat it and what options you have. But again, it is very important in terms of managing expectations that it is clear we are only able to manage the condition, we cannot cure it. So atopic dermatitis, as you can see from the diagram, where skin cells are less tightly held together. This means that allergens more readily penetrate into the skin, which results in inflammation. So it is a barrier defect within the skin, and it is associated with skin-related allergies. Another chronic inflammatory skin condition, and those that suffer typically report dry, itchy, or inflamed skin. Often there is a personal family history of this particular condition, very prone to allergies such as asthma and also eczema as well. So we also have what's called the neuropeptide link. So sensitive skin is often linked to the role of neuropeptides. These are small protein-like molecules used by neurons to communicate with each other. Now, when neuropeptides are released by nerve endings in the skin, they play a crucial role in the skin's response to external stimuli. So one key neuropeptide is called substance P. It's one of the most well-known neuropeptides, and it's associated with skin sensitivity. So essentially, it causes vasodilation, or the widening of the blood vessels, which leads to that redness and increased permeability of blood vessels. Now, it is activated by environmental triggers, such as UV radiation, also by chemical irritants as well. These can activate the sensory nerves in the skin, which leads to the release of neuropeptides and to a condition called neurogenic inflammation. So it is an intrinsic, as we've covered, response to stress. So a holistic approach to skin wellness. If you have watched any of my previous webinars, you'll know that a holistic approach to skin wellness is something that I find extremely important. So this is when we're looking at how best to recommend the best products, the best treatments, but not only that, we need to know what their lifestyle is like. What do they do on a daily basis? What could be causing any issues that they come to you with? So treating somebody holistically kind of looks at every aspect of their daily life and managing it in the best way possible to give them the best outcome. So the first part of that is within the consultation. So the consultation is not always the first step, not always that first interaction with your potential patient. They could have sent you a message via social media, picked up the phone and had a telephone conversation with you, but that consultation is an essential step in beginning the process to help them achieve their skin health. So we want to understand step by step their current skincare routine, if there is one. Sometimes people come to me and it's kind of all over the place, and they'll have a cupboard full of products that they've used a few times, have had a terrible response to, and they've just kind of left them and tried something else. So we need to understand what they're using, how often they're using it, to potentially uncover some of the triggers. Lifestyle modifications. So here we look at things like their diet. We know that certain foods can aggravate the gut. Gut health is very closely linked to skin health. Therefore, if there are potentially any diet triggers there, we can alleviate those and hopefully improve gut health. As a result, we can then look to improve skin health as well. Stress management, as I've mentioned, is a bit of a vicious cycle in terms of looking at techniques potentially where we can practice mindfulness, relaxation exercises for overall well-being. If we can focus on our well-being, then sometimes that trigger being alleviated can be enough. Sleep management as well. Are they getting enough sleep? Are they drinking enough water? The very obvious things that we think of, sometimes it's just an easy fix. We then, when we have all the information that we need, we can then produce a treatment and product plan for them. Sensitive skin, admittedly, is probably one of the most difficult skin conditions that you will try and treat, in the sense that depending on how severe that sensitive skin is, it might not leave you a lot of options for treatment. Therefore, you're relying on that lifestyle modification, but also the correct product use as well. So how to approach treatment? You want to look at, is the barrier compromised? So look at lipid levels within the skin. When the barrier is compromised, the skin is very often dehydrated. So it's an obvious sign that you are looking for when doing your consultations and your skin analysis. This issue needs to be addressed. We need to look to improve the water content within the skin. Generally, sensitized skin will also have some kind of inflammation or redness that you will be looking for as well. So we're going to select key ingredients that address each of these individual points. So we want to look to soothing ingredients that address inflammation. We want to reinforce the skin with lipids, and we also want to restore the water content and improve overall hydration. Patch testing, I will say, in terms of introduction of new products, is extremely important. Now, by patch test, I don't mean what we would typically do. Let's say if you were doing a laser treatment and you had them in for a patch test before that treatment, it's not like when you do a skin peel and you will do a small patch test. Give them samples of the products that you want them to use. If they're using a sample, it might last them a day or two. That way they get a sense of the product, how to use it, and that it's not going to aggravate those symptoms that they already have. So it gives them then the confidence that what you're explaining to them that they should use will have a positive effect. Now, treatments. So as I've just mentioned, treatments sometimes for sensitive and sensitized skin can be slightly limited. So we do have to be very, very careful here. I will talk about what we always talk about in these webinars, and that, of course, is microneedling. But I will say microneedling has to be done with extreme caution. So looking at the skin type, more often than not, with a very sensitive skin, it may not be a suitable option. But from what we know about microneedling, how it impacts the skin, how it improves the skin, we know that it potentially could have a positive effect on some of the issues that we see. So I looked at the rosacea picture previously, and very, very mild rosacea can benefit from that product penetration. That's one of the reasons I've used the HES picture there. HES is a fantastic power solution for a really sensitive skin. It's just how we use it. We need to be very, very careful. So we can use kind of non-needle mesotherapy machines with the power solutions. That's something that is quite popular in the UK here. So that means that we're getting that product with those beneficial ingredients in there to help alleviate some of the symptoms that we see with the sensitive skin. So it's that product absorption that can help. We know that microneedling can also stimulate the body's natural healing response, which for somebody with a sensitive or sensitized skin, that wound healing is obviously impaired. So anything that we can do to naturally improve the wound healing response within the skin will have a positive benefit. Now, some of the ingredients that we know are in the HES power solution, your sodium hyaluronate. So that is obviously a fantastic hydrator for the skin. So those that are suffering with impaired skin barrier, with that transepidermal water loss, what a fantastic ingredient to introduce to them. LED. Now, in most cases of sensitive skin, sensitized skin, LED you can absolutely use as a treatment option for them. So we know that LED is low level, non-invasive, and highly, highly accurate in treating various different skin conditions. So utilizing various different wavelengths of light, we can target some of the issues that we might see within a sensitive skin. So for example, those that suffer with acne or pustules as a result of that sensitivity, we can target the bacteria with blue light. We can also help reduce inflammation with the red and the infrared as well. LED we know is generally safe and soothing for sensitive skin. Now, other treatments that you may be familiar with, for example, things like microdermabrasion, dermaplaning, I'm trying to think of another. These are things that really we should just best avoid. As I mentioned, there are quite a limited number of treatments that will help target and improve a sensitive skin. Chemical peels as another example. They're going to be far too strong to help alleviate those signs and symptoms of a sensitive skin. So we want to keep it very safe, non-invasive, essentially quite low level. Now you do have things like skin boosters. Philo is very popular. Anything that can help to boost skin's hydration potentially could be a fantastic treatment. for somebody that suffers essentially with that dry, cracked symptom of sensitive skin. We also have topical treatments and masks available. Obviously, things like the peptide gel mask are normally used in conjunction with your professional treatments, especially things like microneedling. But these can be utilised on their own in clinic as part of a kind of a bespoke treatment that you can put together for your patients as well. So still try and utilise things like this. Of course, we have the soothing Bomb C algae mask. Also, that is fantastic for soothing and calming a sensitive skin. So utilise things like your topical treatment masks alongside things like your LED, hydrodermabrasion, anything that isn't too abrasive and more nourishing for the skin would be ideal. So we'll look now to some of the ingredients to avoid, and of course, ingredients that we want to include in a recommended skincare routine for those with sensitive skin. And we'll have a look specifically at some of the Genesis products that would be recommended as well. So things to avoid within your consultation, things to look for, potential triggers that may have caused the skin to become more sensitized. If they say that when they cleanse their skin, when they clean their skin, if they get a tight sensation or a squeaky clean feeling, that's actually a sign that the barrier lipid layer has been completely stripped back. So it is impacting directly on the skin barrier. So if that is happening, if they report that that is the sensation that they get after they cleanse, they need to change whatever that product is immediately. If they use soap, I hate to say it, but some people do, if they use soap as a way to cleanse their skin, again, get rid immediately. Obviously, your sulfates keep that soap together, and again, can have a terrible, terrible effect on the skin barrier itself. So anything like that needs to be removed from the skincare routine instantly. Anything alcohol or acetone based, in particular toners, will also strip the skin of its barrier lipids. So it will quite quickly make the skin feel quite sensitized. Again, that step may need to be replaced using appropriate toners. The toner itself may need to be completely removed from the skincare routine. The pH of a product is extremely important as well. So the pH obviously is a measurement of how acidic or alkaline a product actually is. And we want to be able to maintain the acid mantle of the skin. Now, if something is too acidic, obviously, it's very quickly going to make that skin quite sensitized. Maintaining that pH is extremely important. Exfoliation as a step within a skincare routine needs to be practiced with caution for most people. So exfoliation can come in the form of either chemical or mechanical. So with a chemical exfoliation, we're talking about alpha hydroxy acids and beta hydroxy acids as the main ingredient to help rid the skin of dead skin cells. And also your chemical exfoliators at home tend to be the scrubs that have that pumice inside. So there's an over exfoliation. You are literally creating those potential fissures, cracks in the skin that is going to lead to irritation. Synthetic fragrances need to be avoided. Perfumes certainly need to be avoided. And again, kind of thinking about skincare routines, I kind of think of males specifically, you know, they use soap in the shower, and this is not all males, certainly not in my household, but soap in the shower, then they shave, then they apply alcohol-based aftershaves. So it is kind of a recipe essentially for sensitized skin. When you apply perfume, yourselves. Think about where you're applying it. Don't apply it to the neck, anywhere that's exposed to UV rays, as it can make you more sensitive to damage caused by UV. So there's a condition called poikiloderma ovsivat, which I've seen quite a few times in clinic, and it tends to be broken blood vessels and pigmentation on the sides of the neck, and then a clear patch directly underneath the chin. And that is due to the use of perfume on the skin. So you go here, and then you're in direct sunlight without SPF, and that results in that mix of broken blood vessels and hyperpigmentation as well. So it's, again, another condition to kind of be quite aware of. Beneficial ingredients, of course, we want to use humectants. Humectants bind to water and hydrate skin by drawing water into the skin cells themselves. So we are looking at things like hyaluronic acid in many different forms. Obviously, different weights of hyaluronic acid in certain products as well are beneficial. Glycerin, as well as shea butter, are just some examples of beneficial ingredients that will help a sensitive and sensitized skin. Occlusives can be useful as well. So an occlusive will coat the surface and prevent water from escaping. Now, I would say that that is in the more severe water loss cases where you really need to protect that transepidermal water loss. So a specific skincare regimen for sensitive skin. Some more key ingredients include things like ceramides, hyaluronic acid we mentioned, niacinamide, Centella asiatica, licorice root extract, and beta-glucans. These are some ingredients that you will see in the next few slides in the products of Genesis that I have chosen to show you. So we then need a step-by-step guide to a gentle skincare routine that is suitable for sensitive skin types. Now, step-by-step guide doesn't mean to say that there needs to be 10 steps involved in that skincare routine. Often with a sensitized skin, you really need to just be very, very basic with how you treat it, certainly in the initial stages. As I mentioned already, patch testing is essential, so giving them samples of the product you want them to use for a day or two is essential in making sure that that particular routine is going to be beneficial to them, and it gives them trust in you. Gradual introduction of any new product is also essential, just to alleviate any possibility that there could be something else as a trigger for them. So clinical trials. The next few slides are the products that I've chosen, specifically for looking at targeting a sensitive skin. Some of these products have actually quite recently undergone clinical trials to show their effectiveness. So what I will show you for some of the products that I've chosen are the results of those clinical trials. Should you wish to have more kind of in-depth information about the clinical trials, then please reach out to your distributors who should be able to give you that information. Genesis as a brand, as we know, you have your professional power solutions. They have the 5 new additions, so nothing synthetic within those. And a lot of the Genesis range as well follow the same suit in that we stay clear of many artificial ingredients, which means that although I've picked kind of a limited number specifically for sensitive skin in terms of products, there is a lot outside of what I've picked that could also be beneficial to those that suffer. Let's not forget that those with sensitive or sensitized skin could potentially have other issues as well, such as concerns about aging or hyperpigmentation as an example, and that's when you may find other products that will benefit them. But I will take you through some of the ones specifically that I have chosen. So I start with, I suppose, what I'd like to think is quite an obvious product for anybody that is suffering with a quickly sensitized skin or an inherent sensitive skin, and that is your skin barrier protecting cream. So as you can see, two of the main things that happen that cause us sensitive skin is that loss of water. It's also irritants and microbes that get into the skin that create sensitivity. So what your skin barrier protecting cream does is protects that transepidermal water loss. It retains moisture within the skin, and it also helps to block irritants and microbes from becoming an issue. So looking at some of the ingredients within the skin barrier protecting cream, you'll start to kind of notice some of the ones that I mentioned previously. So ceramide MP is a major epidermal intercellular lipid component. It reinforces the skin's natural barrier or lipid barrier, and it improves long-term moisturizing effects. So if you are in doubt of what product to introduce and when, always kind of start potentially with skin barrier protecting cream, replacing those lipids that we need as part of our skin barrier. So we then have a complex of plant extracts which have an excellent anti-inflammatory effect and also actively act as a barrier that will stop any of those irritating factors that have become an issue, creating that sensitized skin. We have an ingredient that I've mentioned previously, shea butter, and that helps to retain moisture and lessens that moisture loss as well on the skin surface. It also keeps the intercellular structure of the epidermis intact, which, as the diagram shows, helps to keep irritants out. So skin barrier protecting cream is a fantastic solution for anybody suffering with sensitive or sensitized skin. Now, as I mentioned, we have, Genesis have conducted clinical trials for a number of their products, and the next few slides I'll take you through will show you some of those clinical results. Now, the clinical trial for the skin barrier protecting cream, we actually have 9 case studies available. Now, I've shown you this particular one as I feel it quite strongly represents just how good this particular product actually is. So we look at the protection of skin against damage, which has been induced by chemical stimuli. So within this particular trial, the cream was used for a period of 2 weeks prior to any stimulus. That chemical stimulus that was then applied within the trial was a sodium lauryl sulfate, so applied to a small section of skin. It was then studied, the skin, 24 hours after the stimuli and then 72 hours after the stimuli. So when you look at the slide, you can see that on the left, this is the skin that has used the skin barrier protecting cream. And you can see that 24 hours after that stimuli, there is a little bit of inflammation still, but within 72 hours, it has practically returned back to normal. Now, on the opposing side, on the right-hand side, you can see that that particular case study has not used the skin barrier protecting cream. You see quite intensive inflammation and redness 24 hours, and you still see the redness 72 hours later. So you can just see what a difference the skin barrier protecting cream actually does. So essentially what that shows us is the skin barrier protecting cream, yes, it can fix issues of sensitivity, but it also prevents as well. So that's ideal for anybody that knows specific triggers, especially chemical triggers that can affect their skin. The skin barrier protecting cream is there to alleviate them altogether. So I think that case study really well reflects just how good that particular product is. Now we also look here at significant improvement 2 weeks after compared to the current control group, and the skin's recovery ability against chemical stimuli. Again, if you want the results of the whole trial, the different case studies, please do ask. Again, perhaps you might think of this as an obvious solution. You're all for sensitive serum. It has been designed with sensitive skin in mind. And again, you will see a lot of the similar ingredients mentioned previously, such as your sodium hyaluronate. Of course, that is water retention in the skin. HA within the skin attracts more water, so it physically hydrates the skin. But then you have also, as you see in the HES professional solution, your Phytofinger C, which acts as a precursor of ceramide. This gives a protective layer for the stratum corneum, and it prevents the skin from moisture loss, helping to maintain its homeostasis. You then have witch hazel extract, which is a strong antioxidant and astringent. So it can help reduce flakiness as a particular sign of sensitive skin. You have pumpkin ferment extract, which has phytochemicals, proteolytic fractions by fermentation, and it has a very gentle kind of exfoliating and smoothing effect. You then have beta-glucan. It penetrates the skin deeply and has anti-inflammatory effects. It also has the benefit of collagen production as well. The moisture replenishing hyaluron serum, also the moisture replenishing hyaluron cream. So again, this has been clinically studied, and you can have these results should you wish to see them. Please just ask. But we look to, again, the ingredients within this product are going to help compromise skin, especially where the main signs and symptoms are that dehydrated, dry skin effect. So you have the coconut water, which gives the skin natural electrolytes, the hyaluron 10 multi-complex, which is your high, medium, and low hyaluronic acid forms. So 11 hyaluronic acid in total, and Tremella fusiformis, which is your mushroom complex. It's able to hold 500 times its weight in water. So again, the main aim of the serum in particular is to hydrate the skin, and your mushroom complex is a source of polysaccharides. So it helps to focus on reducing that skin inflammation. It's also antimicrobial and antiviral, and has high amounts of antioxidants. Pentavitin is that moisture magnet in the skin, and it binds itself to free amino acids and helps to attract more water to the skin. So this is ideal for those that are really, really suffering with hydration as an effect on the skin. And again, you have the same ingredients as we just covered in the moisture replenishing hyaluron cream as well, with the addition of the complex of xylitol and erythritol. So for anybody that suffers with that stinging sensation, burning sensation on the skin, this complex in particular will have a real soothing and cooling effect. Now, something that you can also consider with that point in mind is that a lot of the creams and serums in particular, you can put into a fridge, a skincare fridge. These are quite common, really popular at the moment. If you keep the skin products nice and cool, again, it will have an instant cooling and anti-inflammatory effect on the skin. So to look now at the clinical trial for the moisture replenishing hyaluron cream. For this, we see actually there was 10 case studies in total to be viewed, all very, very similar in terms of the positive effect that you see from the application of this particular product. Now, to kind of explain what we see here, the product is applied and we see an instant increase in the hydration levels of the skin. So immediately after use, in this particular example, you see 101% increase in the moisture content of the skin. Now, quite importantly, what was wanting to look at is how we maintain that moisture level in the skin 72 hours later. So all of the case studies in this particular example were brought back in to then remeasure the hydration levels 72 hours later. And as you can see from the results here, we still have that 73.7 increase in hydration levels after 3 days of using the product. Just to explain, the brighter the blue colour in the slides, the more moisture content in the skin. So you can see from baseline to immediately after is a hugely significant difference. We, of course, Genesis have had the intensive hydro-soothing cream now for a long time. I use this quite frequently in conjunction with a lot of professional treatments in particular. However, it can also be used as home care as well. So slightly different in terms of ingredients that we have in here. We have, again, that sodium hyaluronate, which is directly going to affect the water binding capacity within the skin. It helps to increase smoothness and softening of any kind of lines and wrinkles. We have betaine, which is a humectant, very important, and also an anti-irritant as well. Aloe leaf extract, so that aloe has an instant cooling property, so it's very common with wounds, for healing or soothing acne, pimples, and even for rosacea-prone clients. We then have that snail secretion filtrate, which is great in terms of its anti-aging properties. As I mentioned, we're not always just treating sensitive skin. We're still concerned with other issues as well that we may have, aging being one of them. Phytolex SC, that deals directly with inflammation. And pumpkin ferment extract, as I mentioned previously, has slightly skin cell turnover impact as well, but obviously very, very gentle. Beta-glucan we see again, as we've mentioned, is extremely beneficial to those with sensitive skin. The microbiome energy infusing mist, I don't think I have as such a favourite Genesis product, but if I did, this one would be very high on the list. So this is great if we're to think about environmental factors, especially that might impact a sensitized and sensitive skin. So I use this quite a lot in the winter when my skin feels drier, but it's also beneficial for those that have UV exposure as one of their triggers. So this can be used quite frequently. It can be used throughout the day. So this is quite revolutionary in the sense that you're not limited to AM or PM application. You can continue to use this throughout the day, even if you're wearing makeup. So it is good for skin nutrition, hydration instant. When the skin water or oil balance is broken, to soothe dry, cracked or flaky skin, and to give the skin a natural glow and a boost. Now, some of the ingredients in here, again, we see shea butter as an ingredient, really fantastic for sensitive and sensitized skin. So it helps to maintain moisture, lessens the loss of water from the skin as well. We have a hyaluron 10 complex within here as well. So again, it's using those hyaluronic acid, different molecular weights to help to improve the moisture level in the skin. Clinical trials have also been conducted for the microbiome energy infusing mist. So with this clinical trial specifically, it was investigated the effect on transepidermal water loss improvement. Now, this is after using the product for a total of 3 weeks. So we could see from the results that transepidermal water loss was improved by 8%. It was also investigated skin hydration value, again, after 3 weeks of using the product. So within 3 weeks, it was reportedly improved by 36%. And that is a huge jump, especially for anybody that suffers with dry skin as one of their main symptoms. Skin Rescue Overnight Cream Mask. This is, again, an essential product, I would say, in terms of anybody that suffers with a sensitive or sensitized skin. It can be used in a number of different ways, as the name suggests. It's a mask that can be applied prior to going to bed on a night and left on the skin overnight. Typically, we're going to use this once or twice a week, applying a sufficient amount of the product on the face as the last step of a skincare routine. So still using normal products that we have included in the skincare routine to add this as an extra step. It can also be used as post-care to provide extra skin protection after specific procedures, and this will help to give the skin a protective film. Within here, you have, again, anti-inflammatory, antibacterial, and antioxidant effects. Pink ceramide complex, again, you've got more of your ceramide MP within this product as well. And oxygen saturated phospholipids as well. So this will help promote cell metabolism. And of course, when we use it as post-care, help improve the wound healing response in the skin. So when this particular product was studied, again, we're looking at transepidermal water loss improvement as well as this time erythema value also. So for that transepidermal water loss, this was having used the product for a total of 4 weeks. It was improved by 15%. So again, quite a significant improvement in terms of alleviating that transepidermal water loss within the skin. Looking at erythema value as well. So one of the main concerns I would say for anybody with a sensitive skin is that dilated blood vessel creating redness on the surface of the skin. This was improved over a course of 4 weeks by 26%. So that is the particular participant being tested at the beginning of the study and after 4 weeks. Now, again, we can see a significant improvement there for erythema as well. So the Soothing Post Repair Cream, typically you'll be familiar with this as, again, used post-procedure. So we are looking at, in particular, microneedling is something that I would tend to use or give to patients to use post-procedure. But if you have somebody that comes to you with extreme or excessive case of sensitive and sensitized skin, this could be an interim product for them to use. So when we include things like the SH polypeptide 7, it's directly delivered into the skin and activates the stem cells. So it has kind of an immediate wound healing response within the skin. You see beta-glucan in there again, sodium hyaluronate, also centella complex, things like centella asiatica, enhances the skin barrier function. So it can almost have an instant effect on the skin barrier, which of course is essential in fixing anybody main symptoms of sensitive and sensitized skin. Then we have a derivative of licorice root extract, also an anti-inflammatory, inhibiting the release of histamine, which slows down the arachidonic acid cascade, which is associated with your inflammation. And then more of your anti-inflammatory, antioxidant, and antimicrobial effect. And panthenol, provitamin B5, which helps to reduce itching and inflammation, which is why I think it's such a good product to include for a short amount of time in the initial stages of them actually coming to you for a consultation. It's one of the first things that you could potentially introduce. Again, the clinical trials for this one, this went through physical stimuli, referred to as tape stripping. So it was causing direct inflammation to the skin. And again, you can see the difference in the skin before application, 2 weeks after application, that's of the tape stripping, and 1 hour after tape stripping. So again, you can see such a huge difference when we apply the skin barrier, the soothing repair post cream. You see the difference an hour after the stimulus was applied to, you know, how inflamed the skin is in the control group when compared to the skin that's used the soothing repair post cream. So a huge effect, but a very quick effect as well, which is exactly what we need when we're treating sensitive skin. So we look here at a significant improvement 2 weeks after use before tape stripping compared to the control group. We also see the skin recovery ability against the physical stimulus is reinforced with 2-week application of soothing repair post cream. So the soothing repair post cream also serves as, again, much like the skin barrier cream will do, it will protect the skin from physical stimulus that acts as the trigger for sensitive skin. And of course, it wouldn't be a webinar of mine unless I mentioned SPF. So SPF is essential in protecting the skin throughout the day. Any environment, any country, it doesn't matter the weather, SPF, especially for a sensitive and sensitized skin, is completely essential. As you'll know, there is a number of different Genesis products that contain SPF within them. So I've chosen here the Ultra Shield Sun Cream, which is your high factor, high rated SPF for both face and body. So it's a factor 50, strongly helps to defend against those UV rays, but also helps to calm the skin as well. As I mentioned, there are a number of different potential concerns that somebody with a sensitive or sensitized skin will face. So it's why I've chosen to kind of highlight a couple more products that we will know and be familiar with within the Genesis range. So your multifunction anti-wrinkle serum, we know is going to be quite suitable for somebody with a sensitive and sensitized skin. And the reason for that is because we've taken away that irritating element of something like a retinol and replaced it with plant-based bakuchiol, which we know is much calmer, has the same effect, but it doesn't essentially irritate and make the skin more sensitive. Within your multifunctional anti-wrinkle serum, there is also that lipid barrier liposome, which is a component of intercellular lipid, forms skin barrier. The lipid barrier liposome helps to strengthen the binding force of the skin barrier itself. We then look to potentially something like the problem control serum. So if one of the symptoms of that sensitive and sensitized skin, in particular, is acne, pustules, then you may need to look at something like the problem control serum, which has more of the ingredients that are geared towards treating that kind of skin type. So within the problem control serum, you have things like zinc and PCA that helps inhibit the proliferation of propionibacterium. So it's going to directly affect Staphylococcus epidermidis. Essentially, it targets that acne issue directly. You also have willow bark extract in there, which is your anti-inflammatory. It also helps with abnormal desquamation of cells, so it helps to slow things down. It works as an exfoliant, but a gentle exfoliant. Allantoin for moisture retention. Again, you see beta-glucan in there and your pumpkin ferment extract. But this is where you may want to kind of use different products depending on their particular symptoms. So in conclusion, What we want to identify first of all, is skin sensitive or is it sensitized? The first question you will ask in consultation is, has this been an issue for you for as long as you can remember? If the answer is yes, then it's highly likely that their skin is sensitive as opposed to sensitized. In that case, you know it's management as opposed to treatment. As long as you can guarantee kind of realistic expectations for that particular person. 9 times out of 10, I would say that they are likely to be more sensitized. But as I said, because they come to you armed with a lot of information, it's likely that they'll sit in front of you and say, my skin is sensitive, what do I do? Identify the triggers. That's absolutely essential as a first step in seeing if we can actually alleviate and remove those triggers from their lifestyle, if it's a lifestyle factor, from their skincare routine, if it's an issue with the products that they're using. Is the skin barrier impaired? Look for signs and symptoms that it is. So instant visibility is going to be redness, either in patches or diffuse across the skin. Potentially dry, cracked and flaky skin, as well as some of the signs that you will see with an impaired skin barrier. That's the first thing that you want to try and fix. Incorporate any new skincare routine and treatments where suitable once a patch test is carried out. Give them samples to try, make sure that they are suitable for their skin. Introduce any new products very, very gradually. First, repair the skin barrier function, replace any lost lipids and any lost moisture, and then perhaps think about incorporating certain treatments into that as well. Thank you very much once again for attending tonight. I hope it's been some use, some value to you. And once again, I've enjoyed the opportunity to sit and talk with you. We will have a look through some questions now. So if you do have any questions for me or for the team, if I can't answer them immediately, we will get back to you as soon as possible. And let me just see if I can open the chat function.